Hello everyone and welcome to my channel. My name is Maria, and on my channel I create videos around everything nursing. I also have a handful of lifestyle content, so make sure you check it out. I am trying to get to 10,000 subscribers, so I'd really appreciate it if you guys subscribed to my channel. I'd also appreciate it if you guys gave this video a like. Not only does it help with the growth of my channel, it also tells YouTube that you guys would like to see more videos like this. As always, this video is in partnership with www.nursingpersonstatement.co.uk, so make sure you check that website out. It is such a fantastic resource. Let's just start. What is care? Care is basically the nature of what we do. We help to care for our patients, we help to care for members of the wider public, and it is important that when we do care for patients, we're caring for them in a way that they would like. We're caring for them in a way that is dignified. Going back to the previous point, in terms of caring for patients in a way that they would like, how you would care for patient A is very different from how you would care for patient B. Why? Because it is not a one size fits all. I know sometimes in hospitals it might feel like that, and I guess in some cases unfortunately it is, but care isn't a one size fits all. What we are trying to do is create personalized care plans for people, because when care plans are personalized, we know that it is more effective for that particular patient. Care doesn't only mean delivering high quality care, it means consistently delivering high quality care. We can look at ages, whether the patient is 2, whether the patient is 37, whether the patient is 59, or whether the patient is 101. We want to make sure that we consistently deliver high quality care, and one way that we can do that is if we are non-judgmental as nurses. Age is a very easy number to look at when I'm trying to explain consistently delivering high quality care. We also want to see high quality care across the different fields of nursing, whether it's mental health nursing, whether it's adult nursing, learning disability, pediatric nursing. We want to make sure that we deliver high quality care. Whether the patient is a black patient, whether the patient is a white patient, we want to make sure that we deliver high quality care. Whether the patient has taken drugs several times in the past, whether the patient, has self-inflicted injuries, whether the patient, never complied with their medication in the past, whether the patient was born in the UK or born in a different country, whether the patient makes £1 million a year, or if they make £10 or if they make zero money a year, we want to make sure that the care that we are delivering to patients is consistent. If we look at the culture of care as a whole, and we look at the kind of unwanted variation in healthcare, we know that care and quality is one of them. The next C is compassion. That involves empathy, sympathizing with people, just basically being kind and being nice to people, not just to your patients, but also being nice to the people that you work with, because I think sometimes people forget that. Like, yeah, you can be nice to patients, but if you're being horrible to the people that you're working with, then come on, there's no need. Everybody's working together. It also means treating people with respect and treating your patients as humans. Patients are humans, they're not diseases. Referring to patients as the diabetic one, or the one with lung cancer, or the person in bed 1E, or the patient in bay D. It also involves being kind and empathizing with what people are going through. Sometimes I look at patients and I'm thinking wow, when I read their past medical history, when I just look at all the cannulas and all the lines and all the drains and everything that they've got attached to them, I'm thinking wow, if I had the life that you had, if I had the experiences, if I experienced what you experienced, if I was in your shoes, how would I react? And most of the time it's for what you've been through and for what you're currently going through, you're actually doing a fantastic job. You're actually doing a fantastic job. I know sometimes they may be stroppy, sometimes they roll their eyes, but it's really, if it was any one of us, it's very easy for us to say, oh, the patient was being rude, or the patient's being difficult. What is a difficult patient? When you're put in a situation where you've got people prodding and poking you, where you can't even live a normal quality of life, how do you expect anyone to behave? How? And at the same time, I do want to say that it doesn't mean that you should tolerate abuse. Best believe, if you swear at me and I've told you not to and you continue, best believe I will do a day tics on you. It doesn't mean compassion in nursing practice, doesn't mean tolerating you know, XXX from anyone. It doesn't mean that. It doesn't mean tolerating XXX from patients. It doesn't mean tolerating XXX from the people that you're working with. Be nice, but don't be a mug. When I think of competence, for me, I feel like competence is probably the easiest one to understand just because it's in every single profession. And competence, the first thing that comes to mind is, you know, knowing what it is that you're doing. That means attending the university lectures as a nursing student. As a registered nurse, it means that you know what it is that you're doing for your patients. For example, I do have a video talking about, what was I talking about? I was talking about the 10 rights of drug communication, the 10 rights of drug administration. That comes under the scheme, that comes under the headline of competence. Knowing what you're doing, knowing what is and what isn't the best treatment options for your patients, and also being able to relay that to a level of English or a method of communication that they will understand, and tailoring that to your patient. I do want to quickly say that obviously because of how I structured the video, it may come across that, you know, each C exists on its own. No, they don't. They're all intertwined. They all work together. But bringing it back to communication is making sure that we relay information to the patients, but like I said, relaying it to them in a way that they can understand. It also means gaining informed consent. It also means not making assumptions. Don't assume that just because they did it one day, they're going to want to do it another day. Communication in nursing practice also involves, you know, includes documentation, and that is something that I know that me myself need to work on, and you know, probably some of you guys also need to work on as well. It also means documentation, making sure that you're documenting the relevant information at a timely and also at in an appropriate manner. Don't just look at healthcare individually. I always say it's health and social care. Health and social care. We have to make sure that we try our best to maintain the communication between both departments and, in a sense, see as a whole, because I'm sure a lot of you guys who are maybe already nursing students, or when you do become a nursing student, guaranteed you will come across so many patients who have had a fall at home. They were on the floor for like 3 days, no one called, no one came to visit to see how they were. It was only because the postman looked through the letterbox and saw an old lady or an old man on the floor and called the ambulance or the police. Now, you know, patient has been taken to the hospital, patient's recovered, you know, all of that stuff. The acute complaint is, the acute problem that they've had has been dealt with. They're fine. They're no longer dehydrated. All their electrolytes are fine. You know, the patient's ready to go home. But are they ready to go home? The patient can't go home because their home hasn't been adapted. Now it is no longer a health issue. It is a social issue. And now the patient's in hospital for like an extra week, an extra 2 weeks, an extra 3 weeks because of the social issue. So yeah, it's making sure that we try our best to keep health and social care together. Previously, a lot of people saw them as two separate things, but they're not two separate things. Keep them as closely together as we can. And you know, some people, I'm sure someone's gonna ask, oh, but I'm just a student nurse, I'm just a registered nurse. How do I try and combine health and social care together? And one way could be, you know, making sure that we're doing appropriate assessments of patients. For example, if a patient really is an assistance of 2, please don't say that they're an assistance of 1. If a patient walks with a Zimmer frame, but they don't have the Zimmer frame with them, making sure that we're involving the relevant people early on. Having the courage could be something as simple as, actually the patient really isn't an assistance of 1, they're actually like an assistance of 2 or 3. Having the courage for your own practice could be something like, oh, actually, I'm not that confident with doing X, Y, and Z. I'm not confident with administering this IV medication because X, Y, and Z, I need some help. That's what encourage means. It doesn't just mean advocating for your patients and the people that you're working with. It also means advocating for yourself. And I also feel that to be courageous in nursing practice, you also have to be a reflective individual. Don't wait for your 3-year revalidation. Don't wait for that reflective nursing essay before you actually start thinking about, you know, this is where I'm at now, this is where I want to be, this is where I was in the past, and this is how I'm gonna make the changes. Don't wait for somebody else to tell you to be reflective. We should, you know, be reflective individuals. At the end of a nursing shift, think, wow, am I happy with myself? Am I not happy with myself? Why? What's one thing that I would have changed about that shift, and why? What's one thing that I would have added to the shift, and why? What's one thing that me, myself, I could have improved upon, and why? Things like presentations at school, that also means being courageous. If you've got a presentation and you're so scared that you don't go up and present, like, that isn't courageous. Because if you can't do a presentation at work, then how are you going to approach your ward manager and say, hey, can I have some annual leave? How are you going to approach a doctor and say, hey, the prescription is completely wrong, can you change it? How are you going to approach the health and social care team and say, hey, the assessment that the previous nurse has done is out of date, can I update it? You need to be courageous in your nursing practice. The final C that we're going to talk about is being committed. Being committed to your patients throughout the shift, whether it is 8 o'clock in the morning or 8 o'clock in the evening. I know it's very hard if you're doing 13-hour shifts, but being committed throughout the entirety of the shift, that is something that I have myself has recognized. Commitment also means being committed to your nursing practice, not calling sick because, I don't know, you just can't be asked to go work. It's so annoying when people do that, because when you call in sick for silly reasons, because the team doesn't know whether the reason is legitimate or not, they just have to take your word for it. But when you're calling in sick and you could have actually gone to work, it has a negative impact on the other members of the team. But at the same time, like I said, being committed to your patients, being committed to people you work with, but also being committed to yourself. You don't want to overwork yourself. Turning up to your shift on time is a sign of commitment. Think about it. If you've got a nurse who is always late, like she's always 20 minutes late for her shift, people are going to start questioning your commitment. Like, why are you here if you're always 20 minutes late consistently for no good reason, and then when you walk in you've got a cup of coffee and a croissant in your hand? Commitment also involves things like doing your mandatory e-learning. If you've got any mandatory e-learning due, then try your best to make sure you get it on time. So yeah, that's some examples of commitment. I'd really appreciate it if you gave this video a like, and also if you subscribed to my channel. If you want me to do, another follow-up video to this where I look at each 6C individually and give you examples of what that looks like at every level of nursing, then make sure you give this video a thumbs up, comment that in the comments box below, and I'll see you guys in my next video. Bye.